know if we can help you or your family member that's stuck in hospital on TPN or IV nutrition. Stay tuned. I share an update today how we can help you. My name is Patrick Hutzel from intensivecareathome.com, and let's dive into this week's topic, which is home TPN once again. Last week, we've just taken home another client on home TPN. The client was stuck in hospital since about September or August last year, 2024. So it nearly took 6 months for them until they could be discharged, for the simple reason that they didn't find out about us until a few weeks ago. But the bottom line here and the purpose of this video today is, if you are stuck in hospital on TPN, which is IV nutrition, and TPN stands for total parenteral nutrition, right? And you have a PICC line, Hickman's line, a central line, or a porter cath that is needed for the TPN. Well, the good news is we can manage all of that at home, and we can help you get you home, and just like we've done with this particular client last week. So what are the services we are providing for a situation like that? So the services that we are providing are around the nursing care, of course. So the connect and disconnect of TPN. That means whenever the TPN is getting connected and run through an infusion pump, one of our critical care nurses comes, connects the TPN, makes sure the line is patent, and makes sure it's a sterile connection. Of course, it needs to be a sterile procedure. And the same is when the line gets disconnected, right? So we can come twice a day, but also some TPN is running over 24 hours. So that basically means we only need to come once a day for the swab of the bag. The line needs to be flushed and needs to be maintained, of course. Sterile, right? Bloods need to be taken every so often to make sure that the numbers are okay. Electrolytes, all other blood results, full blood counts, and so forth need to be monitored. That is also part of our service. And, also for some clients in the past, we have also provided a 24-hour nursing care service for the TPN, depending on the client situation, whether they had other issues such as ventilation, tracheostomy, of course, but also if they had line blockages, air alarms, and so forth. So it really depends on your situation, what you need. For your unique situation to go home from hospital. But the good news is, don't let the hospital tell you that home TPN can't be done, because we've been doing it for so many clients. And here's another case study where I can show you we can do it, and we are doing it. Now, other services we provide when it comes to home TPN is, of course, to organize the TPN through a third party, of course. So there's companies out there who, are providing TPN in the community. At the moment, we're currently using Baxter, and other services that we are providing. We are liaising with an intensivist, of course, who prescribes the TPN and who's also overseeing the patient from a medical perspective. So if you're stuck in hospital on TPN, and I know there are many people out there who are stuck in hospitals on TPN, and perceptually they can't go home because the hospital says you can't go home, it's not possible. Well, forget about all of that. Give us a call, talk to us, and we can show you a pathway forward how to go home. We can also talk about the cost and who's going to pay for that. I'll talk about the cost more in a minute. But logistically and operationally, this is all possible. We've done it. We are doing it with a number of clients in the community. And just because you're stuck in hospital for months on end doesn't mean we can't take you home. Not at all. And we also have the network with doctors, with Baxter and other suppliers that provide the network to make all of that happen. Our critical care nurses come to your home once, twice a day, or for 24 hours a day, depending on what you need, to keep you at home safely and have the TPN run safely, including all the checks with blood checks and also IV fluids. Sometimes a TPN goes hand in hand with IV fluids as well, which is the case with the client that we've just taken home last week. So we can also give IV fluids if that needs to be given on top of the TPN. So I hope that helps you understand more about home TPN and what's possible. And it's the same if you're a doctor or a nurse or a hospital executive watching this and you have bed blocks in your hospitals because of home TPN. I can only encourage you to reach out to us, because we can help you free up your hospital beds that are blocked by potentially patients stuck in there on TPN, right? And there's also patients in ICU that are on TPN, ventilated tracheostomy. That's also part of our wheelhouse, because with intensive care at home, we are sending our critical care nurses into the home 24 hours a day. Therefore, we are providing a genuine alternative to a long-term stay in intensive care for ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, tracheostomy without ventilation, home TPN, home IV potassium infusions, home IV magnesium infusions, IV fluids, IV antibiotics. We're also providing ventilation and weaning at home. We're providing central line management, PICC line management, Hickman's line management, as well as portacath management at home. We're also providing nasogastric tube management, PEG tube management at home, as well as palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services, and we have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of going to the emergency department. Therefore, we're also in a position to cut the cost of an intensive care bed by around 50%. The intensive care bed costs around $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we are freeing up the most sought after bed in the hospital, which is the ICU bed. But most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. But as you've heard, and with intensive care at home, we're currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. We are an NDIS approved service provider all around Australia, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are the only service provider in Australia that has achieved third-party accreditation for intensive care at home in 2025. We have been achieving this level of accreditation since 2012. No other provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home nursing than we have. That puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. And if you're at home already and you're watching this and you realize that you don't have the right level of support, I'll give you a tangible example here today. One of our first clients over 10 years ago was a client who was at home on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers cannot look after a client at home on a ventilator with a tracheostomy. That is like flying the airplane with a cabin crew instead of the pilot. Because anyone on a ventilator with a tracheostomy is at very high risk of a medical emergency or even dying if they don't have critical care nurses looking after them 24/7. This is evidence-based and it's documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In intensive care in a hospital, you wouldn't have a support worker look after a critical care patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So eventually this client found out about us. We were proving our concept with this client very fast. When we worked with the client, we sent him intensive care nurses 24 hours a day. He never ever went back into ICU ever again. And we were proving our concept there very, very fast. We can do the same for you if you're not safe at home, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients, otherwise we would not be in business. And of course, the same is applicable if you're stuck in hospital in ICU, just similar to our case study today. Reach out to us, we'll make it happen for you. So, we can take you through the right steps. This is also why we're providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDI support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog below the video. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you are an NDI support coordinator or a case manager from another organization watching this, and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We can help you with the right level of funding and with the right level of advocacy. We're also providing NDI specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I have a disclaimer, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients do want the same staff coming over and over again because they are so vulnerable and so special, and that's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availability for shifts, and you're really keen on building relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in ICU and ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help to take the pressure off your ICU and ED beds. And in most cases, you won't even pay for it. Even if you do pay for it, it's much more cost-effective than what you pay for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, respiratory wards, home TPN, of course, please reach out to us as well. We can help you eliminate your bed blocks fast. If you're in the US or in the UK, you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you think about this video and what you want to see next. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days.